The advances in epilepsy surgery are extraordinarily exciting. I am particularly part of an amazing team in the operating room with people like Dr. Perry Bechtel, people like Dr. Tatum, who are extraordinary innovators. And together, we are working in different disciplines and converging to provide care for our patients. We're doing inventions all the way from the operating room and the way we record electrical activity on the brain in such a way that we can predict what parts of the brain are firing abnormally so we can take them out at the time of surgery.
So the field of epilepsy is advancing rapidly in all phases. There are advances in imaging with new techniques in MRI to help try and localize the source of seizures. There are advances in the evaluation in terms of EEG and learning new ways to recognize and localize seizures. And there are advances in surgery trying to find ways to eliminate the seizure focus and minimize any side effects, such as laser ablation, responsive neurostimulation, deep brain stimulation, all are an attempt to improve upon what resective surgery has been able to do for many decades, but to try and minimize or eliminate any of the potential side effects.
I think epilepsy is changing very quickly in terms of what's becoming available. And I think just because you've received one opinion at one point in time and now it's 3 years later, it's worth keeping in contact with your doctor and say, can you re-review my case? And is there something different today than there was 3 years ago that we can do different? Because the medications, they keep changing. There's all these different, more specific medications. And the surgeries keep changing quite a bit too. And our knowledge, it doesn't feel like that as you're growing up, but things change so rapidly that it's really critical, I think, to keep touching base with somebody or keep being evaluated, especially if you still have that chronic problem of epilepsy and you're still not cured. What was not curable 3 years ago might be now, and I think it's kind of important to keep checking in with people.
It's the essential question of how can our innovations have throughput to help the patient? We want to help the patient. How do we establish newer innovations, newer techniques, newer methodologies to get us from A to B? We're not suffering from any technical loss. Technology has advanced. When that starts to happen, then we can get to our end result, which is helping the patients, improving their quality of life.
We are at the frontier in providing the most advanced epileptic surgery care in our operating rooms here at the Mayo Clinic. The next frontier is going to be to try to cure these patients without them needing surgery.